Good day everyone, I'm Geraldine Del Valle and we are the Group 14 and today we will now be discussing mumps.
So, what is mumps? Mumps is a highly contagious viral infection that primarily affects the saliva producing or the salivary glands that are located near our ears. Mumps is also known as parotitis, wherein it has an incubation period of 14 to 18 days. And then the duration of the disease is approximately 7 to 10 days. When we say incubation, incubation is the process of incubating eggs, cells, bacteria, a disease, or etc. What does mumps looks like? So as you can see in the picture, mumps is best known for the puffy cheeks and swollen jaws. Let us now proceed to the history. According to the medical historians, they believe na nanggaling ang mumps sa Greco-Roman times, wherein the first effective vaccine against mumps was first introduced in 1948 and it was used noong 1950 up to 1978. And then, the current childhood mumps immunization wherein nire-recommend nila na magkaroon ng 2 beses na pagpapabakuna sa mga bata at the age of 12 to 15 months and 4 to 6 years of age. Another history, the mumps vaccine is commonly administered as part of a combination vaccine or the MMR, which is known as the measles, mumps, rubella, also providing protection against measles and rubella. When we say rubella, it is also known as German measles. And then it was documented in the US that approximately there are 186,000 cases per year. With immunization, that number has fallen to 2,015 cases in the year 2015. And then nagkaroon daw recently ng outbreaks of mumps in Washington state. Let us now proceed to the causes. Mumps is caused by a virus that spreads easily and can only be transmitted from person to person. If you're not immune, you can contract mumps by breathing in saliva droplets from an infected person who has just sneezed or coughed. You can also contract mumps from sharing utensils or cups with someone who has mumps. The paramyxovirus. Paramyxovirus is a mumps virus wherein it is one of a group of RNA viruses that are predominantly responsible for acute respiratory diseases and are usually transmitted by airborne droplets. It includes the agents of mumps, measles or rubiola, RSV or the respiratory syncytial virus, Newcastle disease, and parainfluenza. When we say Newcastle disease or the NDV, it is a worldwide problem that presents primarily as an acute respiratory diseases. And parainfluenza or the HPV is commonly caused by the respiratory illness in infants and young children. Risk factors for contracting mumps. The following are failure to vaccinate completely, wherein kinakailangan na magpabakuna ng 2 beses ang mga bata. As I mentioned earlier sa history, they recommend to have 2 doses of vaccine sa children in the age of 12 to 15 months and 4 to 6 years of age. Next one is age. Karaniwan na may highest risk of contracting mumps ay sa mga batang edad 2 to 12 years of age. Season. There is an outbreak of mumps particularly during winter or spring season. Travel to high-risk regions of the world. There are high-risk regions of the world such as Africa, General Indian Subcontinent region, and Southeast Asia. So these countries has a low rate of immunization. Weakening immune system. Karaniwan naman ito sa mga taong may sakit, say for example, HIV, AIDS, cancer, born before 1956 to 1957. So, medical historians believe that individuals who have experienced mumps infection in childhood. And then, there's a possibility na kapag hindi sila nadapuan ng mumps, there's a high risk of adult mumps disease. How do healthcare providers diagnose mumps? The purpose of this laboratory studies is to exclude other viruses that may give a similar clinical presentation, as well as to exclude very infrequent similarly presenting parotid gland enlargement, such as salivary gland cancer, Sjogren's syndrome, the IgG4-related disease, sarcoidosis, and then side effects of thiazide diuretics, etc. So we all know that mumps is the inflammation of the parotid gland, or ito yung paglaki ng parotid gland. Let us now proceed to the signs and symptoms. The following are pain in the swollen salivary glands on one or both sides of your face. Second one is pain while chewing or swallowing, fever, headache, muscle aches, weakness and fatigue, and loss of appetite.
So, good day everyone. So, now let's talk about the complications of the mumps. So, may possibility po na magkaroon po tayo ng mga complications po sa ating katawan pag meron po tayong mumps. So, isa na po dito is yung orchitis, ophiritis, the meningitis, the hearing loss, the pancreatitis, and the encephalitis. So, i-explain po natin ng further dito po sa video na to.
Let's now discuss the complications of mumps. First is the orchitis. Orchitis causes one or both testicles to swell in males who've reached puberty. It is painful but rarely leads to inability to produce a child. Second is the ophiritis. It is the inflammation of an ovary in females. It is also called as ovaritis. Third is the meningitis. It is the membranes and fluids around the brain and spinal cord. Occurs when the mumps virus spreads through bloodstream to infect your central nervous system. Fourth is the hearing loss. It can occur in one or both ear. Fifth is the pancreatitis. This condition includes pain in the upper abdomen with the symptoms of nausea and vomiting. And sixth is the encephalitis. It is a viral infection that can lead to inflammation of the brain. It can also cause neurological problems and become life-threatening. Let's go to the prevention. The best way to prevent mumps is to be vaccinated against the disease. Most people have immunity to mumps once they're fully vaccinated. Usually, mumps vaccine is given as a combined MMR or measles, mumps, rubella, which contains the safest and most effective form of each vaccine. 2 doses of MMR vaccine are recommended before a child enters a school. Those vaccines should be given when the child is between ages 12 to 15 months and between ages 4 and 6 years.
So now, let's talk about the prevention. So, ikla-clarify lang po natin yung about sa doses po ng MMR vaccine. So, nasabi po kanina sa video na 2 doses lang po yung kailangan kapag magpapavaccine po tayo. So, hindi po kasi pwedeng single dose lang po siya kasi po hindi po siya magiging effective. And then kapag 3rd dose na po, hindi naman po siya recommended by the doctors or the physician.
And now let's discuss about the people who needs MMR vaccine. First, non-pregnant women of childbearing age. Second, attend college or another post-secondary school. Third, work in a hospital, medical facility, childcare center or school. And fourth, plan to travel overseas or take a cruise. People who doesn't need MMR vaccine. First, people who have or had a life-threatening allergic reaction to the antibiotic neomycin or any other component of the MMR vaccine. Second, pregnant women who plan to get pregnant within the next 4 weeks. Third, people with severely compromised immune systems. Those who have severe illness like cancer, blood disorder, HIV or AIDS, those who are taking steroids which affects the immune system, and those who receive another vaccine within the past 4 weeks should check with their doctors when getting vaccinated for mumps.
So, the people who needs vaccines, ito po yung mga taong exposed po sa environment. And then sila din po yung mga may hina po yung immune system. So, sila po yung nangangailangan ng vaccine ng MMR. And then yung mga tao naman pong hindi kailangan po ng MMR vaccine, sila po yung mga tao meron pong allergic reaction po sa antibiotic na neomycin. Ito po yung isang component po ng MMR vaccine. And then yung mga tao pong meron pong severe illness, sila po yung hindi na po nangangailangan ng vaccine kasi po may mga possibility po na magkaroon po ng complication or lumala pa po yung sakit nila once na nagpa-vaccine po sila. So, bago po sila dapat magpa-vaccine, magpa-consult po na po sila sa mga doctors nila.
Side effects. Some people experience a mild fever or rash or achy joints for a short time. Rarely, children who get the MMR vaccine might experience a seizure caused by fever, but these seizures haven't been associated with any long-term problems. And lastly, for the treatment, there is no specific treatment exist for treating mumps. Warm or cold packs for the parotid gland tenderness and swelling is helpful. Pain relievers such as acetaminophen or Tylenol and ibuprofen or Advil are also helpful.
For the treatment, sinabi po kanina sa video na wala po tayong specific treatment for mumps. So, ang kailangan lang po natin is yung magpa-vaccine po tayo ng MMR vaccine para po sa prevention po ng mumps. And then, kailangan din po natin ng warm or cold packs para po sa swelling and tenderness po ng ating mga parotid glands. Makaka-reduce po yan ng pain. And then, pwede rin po tayong uminom ng mga medicine po like acetaminophen or the Tylenol. And then, yung ibuprofen for the Advil. So, makakatulong po siya for the pain. And then, acetaminophen po ay isang paracetamol. So, that's the end of our report. Thank you for listening and thank you for watching.